Good afternoon, everyone, and welcome to Trust for America's Health's Age-Friendly Public Health Systems, or AFS, monthly training for December. We're really happy that you're here today to join us to learn more about how public health can support older adult health and well-being, and today, in particular, through partnerships with public libraries. Really excited about this topic. My name is Megan Wolf, and I'm joined here today by my colleague, Dr. Karan Phillips. The AFPHS movement would not be possible without the generous support from and partnership with the John A. Hartford Foundation. Next slide, please. So let's do a little housekeeping. So if you all will please keep your devices muted during the presentation today so we can avoid background noise. Feel free to put your questions in the chat throughout the presentation, and we will make sure that we have time at the end for some discussion. Next slide. So your feedback, as always, is very valuable to us. So we ask that at the end of the presentation that you take a few moments to complete the anonymous feedback survey that will automatically pop up at the end of the training. Your insights will be shared with our evaluation partner at the New York Academy of Medicine and will really help us to design our future trainings. Next slide. So as most of you know, TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person and individual. We are most well known for our reports, our annual reports, including Ready or Not, which focuses on emergency preparedness, and Pain in the Nation. Related to healthy aging, we have produced reports on a number of topics, including housing and rural healthy aging, and the one you see on the slide here on how our AFPHS 6Cs framework is aligned with the 10 essential public health services. And you can find all of these resources, the AFPHS resources, on our AFPHS website at www.afphs.org. Next slide, please. So this year, our monthly trainings have all had an equity component, which is at the center of our AFPHS 6Cs framework. And we've been really trying to focus with each of our topics on how each of these areas, how public health can advance equity among older adults and their families and caregivers. So hope that you will all appreciate that and kind of go back. If you haven't seen all of our trainings so far this year, we would appreciate if you go back and take a look, and hopefully they will be of interest and value to your work. So let's get started for today. I'm really excited to introduce today our guest speaker, Fatima Perkins, who is with the Western Reserve Area Agency on Aging, but has a lot of experience on how departments of health are able to partner with public libraries to deliver programming and services and really become a center for older adults in their community. So Fatima, I'm going to turn this over to you now and look forward to your presentation. Thank you for being here.
Hello, everyone. Good afternoon. It is a pleasure to be here. Good afternoon, everyone. It is a pleasure to be here. Thank you, Dr. Phillips, for inviting me today. As mentioned, I have been in the industry of working with older adults for probably about 25 years, and I have been a librarian for 20 years. I have been able to successfully marry those two disciplines and enjoyed finding my passion with programming for older adults through libraries. Today, my presentation is going to focus on how public health and public libraries share a common mission. And I'm going to give you some examples of some things that are being done right now with libraries and public health partnerships, as well as some information about how to connect with public libraries, because public libraries too often have a challenge connecting with other entities in the community where there are likely partnerships. So I need to, how do I advance, guys? It's not going down. Thank you.
Just ask Karan. Just say next slide, please, and we'll make sure you get to the next one.
Thank you so much.
Sure.
Okay, so what is a public library? We all know what a public library is, but a good definition is a library is a collection of resources in a variety of formats. that is organized by information professionals or other experts who provide convenient physical, digital, bibliographic, and intellectual access after targeted services and programs with a mission of educating, informing, or entertaining a variety of audiences, and the goal of stimulating individual learning, advancing safety as a whole. Next. So I wanted to go over what are some library functions, and I hope you saw in the definition about libraries in general some common themes that connect libraries to public health units. So, library functions: providing access to information, offering a diverse collection of books, magazines, movies, music, and digital content for borrowing, supporting learning and research, facilitating access to materials to academic, study, job searches, and personal interest, community engagement, hosting events, programs, classes for all ages, including story times, author talks, and workshops. I hope as I'm going along these library functions, you are thinking to yourself how these functions are similar to some of the things that you may be doing in the community and where we can eventually make connections. Other functions include digital access, offering public computers, internet connectivity, and literacy training. Reference services, everybody's familiar with that, answering questions and providing assistance with research needs, promoting literacy, encouraging reading habits through programs and outreach initiatives, and creating a welcoming space, providing a comfortable environment for studying, reading, and socializing. So when you see the functions of a library, you instantly begin to think about this. Libraries are a community focal point. Historically, they have been trusted and respected by their communities. And many folks say when they move into a community, they do look to see on their checklist if there's a public library nearby that they can access. Next, please. So I wanted to put the two definitions right next to each other and begin to look at how they tie together. So we did the public library definition, and you guys know what public health is about. So the part that I highlighted for public health was this work is achieved by promoting healthy lifestyles, researching disease and injury, prevention and detection, preventing and responding to infectious disease. So you see, it's a very similar definition over here with the library, advancing the society as a whole, whereas you guys are trying to make sure society has healthy lifestyles. We're researching over here or providing reference. You're researching about disease and injury prevention. So there are definitely ways that we can connect, and we will see more of that later in the presentation. Advance, please. So just a few little tidbits about libraries today. There are 131,848 libraries, 17,500 approximately public libraries in the United States. Now, when you look at the research is going back and forth. It is different entities reporting on the actual public libraries. I came across sources that said 9,000, but most of the sources said the 17,500. There are approximately 36,845 paid staff. 6 million programs are delivered to 125 million participants. And I have to say, this number has drastically decreased over the years, and it could have been attributed to the pandemic that we had for a few years and recovering from the pandemic. But at one point in the 2015, 16, 17, there were 1 billion folks going to the library. Okay, 1 billion. Just in case you want to know, folks say that books are better than movies. We talked about how many people are attending the public library programs, and 68% of Americans have a library card. I found this very interesting. There are more libraries than McDonald's, and there are more libraries than Starbucks. Can you believe that? I have a colleague that said, "Did you check Chipotle? Chipotle is probably beating them out." So I said, "I'll check for Chipotle later." 90% of Americans say closing the library would impact them and their family. Now, I am in the greater Cleveland area, and our county is referred to as Cuyahoga County. And even within our county, we have 9 separate library systems. 2 of the bigger systems are the Greater Cleveland Public Library, no, the Cleveland Public Library, which serves Cleveland only and serves neighborhoods. And then you have the Cuyahoga County Public Library, which serves municipalities. So you're probably beginning to see a theme here. In the area that I live in, we have municipal health departments, and then we have county health departments. So there's always a way to connect the two. Libraries and public health. Karen, please. So I just wanted to throw this wheel up here so you guys could take a look at it because it's very colorful and pretty. You already know the essentials of what you do, And there are 10 essentials. And when you begin to look at some of this, you begin to see the automatic overlap with public libraries. And we use these wheels to help us have a better understanding. But public libraries, sometimes they base their programming around, when they're looking at health, around the wellness wheel or around the social determinants of health wheel. And I have to say to you, social determinants of health, though libraries have been closely involved in this arena, we never refer to it as social determinants of health. We really didn't have a grasp of that phrase. Okay, so we would just say, well, we're just helping the community. You know, our strategic plan says that the community wants this, the community wants that, and that's what we're doing. And it just happens to fall into the social determinants of health. Next, please. So libraries and public health. What are some things that libraries are currently doing? Well, libraries are providing health information. Libraries can also advance health literacy in their communities by providing internet access, conducting literature searches, printing resources, and referring people to local health services. Libraries offer access to medical journals, databases, and the internet. They also provide easy to understand articles about health issues. So you can put in the chat if you like, and I'll check over there. What is the thing most older adults do when they're searching on the internet? What are they searching for? What do you think they're searching for? And you can just put that in the chat. Somebody said health-related information, medications, healthcare. Yes, surgical procedures, anything. Well, you guys are real bright here. Info on medicines, oh yeah, Medicare plans. We just closed out on Medicare plans. That's very important. Technology help, yes. Nutrition, yes. So you get the gist. Most older adults, they are looking for health information. Now, many of them uh, decide to learn about technology because they want to stay connected and engaged with family members that may live out of the state or out of their area. But when they are doing searches for themselves, it usually is around health related information. So, the first thing that comes up for me as a librarian is that public health is all about health literacy. This is a natural connection with libraries and programming. So, what are some other things? Libraries help people find health care. Libraries can help people find healthcare providers who meet their needs. They can also help people apply for health insurance. Someone mentioned Medicare plans, and this is very important nowadays. I do see some libraries hosting and conducting workshops about scams. There are a lot of scams out there, particularly around healthcare, telling folks that they can get someone to do their Medicare, application or information for a small fee, send them $100 or send it in a gift card. There are all types of scams around health related things. The next thing that libraries can do with public health, offering health services. And we will talk a little bit about that later. I think I do have some examples of public libraries doing some health related work in this space. Some libraries directly employ medical professionals to provide health services. For example, the Pima County Public Library in Arizona partnered with this local public health department to employ a public health nurse. So back to the chat, folks. I love that somebody put in their social engagement opportunities too, because that is part of being healthy. Why do you think a library would actually employ a public health nurse? Put your response in the chat. Libraries are often community meeting places, hosting presentations and more. True. When you see libraries doing things like this, because we now have libraries also hiring social workers, does that surprise you? I see people shaking their heads. Why does it not surprise you that a library would hire a social worker to be on site?
I mean, it just seems like a natural alignment, right? To think about if a library is a social place, that they could hire a social worker to connect with people who might not be seeking a social worker, social worker support anywhere else.
Absolutely, Megan. There are a lot of things that you probably know, and some, I mean, every region, every city, every county is different. Some areas are busier than others. Some have a little bit more commotion going on. Social workers came about because folks in some areas distressed from unemployment, folks coming in with behavioral health issues that needed to be mitigated. So, this is one of the reasons that they were hiring social workers and then hiring public health nurses. I learned of late, teaching a class for San Jose State University. There are some communities that are bringing nurses in because, in particular, rural communities for public health, because they don't have health facilities nearby. And people need things like medication management, they need vaccinations. They just have general questions about health and things of that nature that a nurse can answer. Someone also put in the chat, also at libraries, safe place for homeless individuals and people with mental health. Absolutely. The library is a safe place. You mentioned homeless, particularly, we have some areas of homelessness throughout the nation where we have more young adults and teens that are homeless. And the libraries have become safe places for them where they don't have to worry about predatory practices. Okay. I know that's very sad, but this is the reality of the world. Um, oh, someone is stepping out. Jane, we'll see you back soon. Okay. Karen, next. Okay, so here's some stuff about libraries in the public health arena. We promote healthy lifestyles. Libraries offer healthy lifestyle services such as walking, hiking, bicycling, or running programs. Nearly 23% of public libraries host fitness or yoga classes. So, when you think about programming at libraries, what you're typically going to find is they're going to fall under a few categories: educational, informational, recreational type programs, or entertainment type programs. So keep that in mind when you're thinking about connecting with libraries. Libraries help support vulnerable populations. They serve as places of refuge, which we just discussed, including people experiencing mental illness, homelessness, immigration challenges, and trauma. I see now where libraries are doing workshops for themselves for self-development around suicide prevention, trauma-informed care, um, crises intervention. These are all things where public health can connect with libraries on. And as a matter of fact, you can do um, cross trainings. Okay. There are things that the library does that public health needs to know about. And these are, every time I mention something, supporting vulnerable populations, two or three things should be popping into your head, into your orbit about where can public health connect in those areas. It's not that libraries don't want to connect with partners. Many times they don't know how. We are still struggling with the word outreach. Many of us are. Outreach means outside of the library, right? So people may still be struggling with that a little bit, that you have to actually go outside to the unserved and underserved populations to help. So partnering with other organizations, libraries often partner with universities, community organizations, and local governments to promote public health. For example, the Atlantic City Free Public Library started a program to provide harm reduction resources and support on a range of health-related needs. Also providing summer meals. You may walk into your library. I don't know if anyone has seen this, put it in the chat if you have, and you see the kiddies there and they're getting their lunch. Okay. This was started years ago. And the reason it was started was because in some areas, when children break for summer, during the school year, they're getting breakfast, they're getting lunch, and they may get an afternoon snack at school. In the summer, if you have families with fragile budgets, many times the kids are not eating regularly. So they started what they termed these programs in the beginning feeding programs, but they have since changed the name to just free lunch, you know. So the kids come to the library and they can get a free lunch. So you know that they're getting a meal at least once a day. And we also know, why is nutrition, public health folks, put in the chat, why is nutrition helpful to the children? Why is nutrition helpful to the children? Just put your answers in the chat, and I'm going to make my comment as we go to the next slide, Miss Phillips. Okay, so it teaches them healthy eating. Yes. Anything else? Food is medicine, right on. Can't learn if thinking about where the next meal is coming from. Yes, you guys are spot on. If you're hungry, you can't think. It gives them the nutrients they need to grow and be healthy. Absolutely. Social engagement. Now, let's talk about this, because this is a good example where public health can be, involved. Because, you can do, I say, express programs. You can come to the library while the kids are having their lunch, and you can do an express program on nutrition for the kids, something very simple and concise, not more than 15 minutes. And the kids are right there. They're a captive audience. Okay. The library would love something like that. Okay. And the kids would love it too, because they like to know what they're eating also. So we know that the brain cannot grow without nutrients. And for many children who are not receiving food on a regular basis, yes, libraries can partner with the food banks to educate about nutrition. When kids don't get food on a regular basis, their brains aren't growing properly. And then when they return to school in the fall, what happens? There's a common phrase: summer what? Summer slide. Summer slide, because children have not had the proper nutrition, no things to eat, nor any additional social engagement with what they have learned to help them retain. So here are some more real world scenarios where communities, libraries, and public health entities have partnered. Public libraries in Salt Lake County, they got together to provide immunization information at story times. Story times are very popular. You have all the kids there, you have all the parents there. Another, what's a wonderful thing to collaborate on for you folks out there that are parents or caregivers of children, and you're taking the kids to the library in the summertime? What's in the summertime? Summer reading. Summer reading. Every public library in the United States has a summer reading program. Wouldn't it be wonderful if the public health entity partnered with the library to do the summer reading program around something about health? Families would love it. Kids would love it. You'd get plenty of sponsors to pay for all the different gifts and things. That would just be fantastic. Someone says, curious whether library summer reading programs use older adult volunteers. It depends on where you're at, if you use volunteers at all, because most libraries are unionized. And there are very strict rules around the type of volunteers you can have. I see now where more libraries are moving towards having people help with some of the story time things, or they will use national programs like Vista, okay, or Senior Corps. something like that where they actually have placements at the library. But it just depends. It depends on your library because, you know, years ago, about 15 years ago, when you said volunteers at the library, it was almost taboo. Okay. I hate to say it, but you know, it was like, oh no, we can't use library, we can't use volunteers. We're you know we're unionized or whatever. But it's certainly a wonderful opportunity for libraries. Okay, so in Perry, Iowa, there's the library partners with the local food rescue organization to make high quality food available for anyone who visits the library to take home. That's wonderful. So you see a lot of the themes for libraries wrap around food, and they're like gingerly stepping to into the space of food security, which is a public health thing and challenge, is one of the social determinants of health. And we know that's very important for everyone to have the food that they need. And we also know that food insecurity is not just about hunger, but it's also about not having adequate food stores where you live at. You could be in a food desert and purchasing all your food from Walgreens or CVS. Okay. Northwestern University, Feinberg School of Medicine, a partnership with the with CPL, I think that's Cleveland Public Library, to develop digital tools for increasing awareness and participation in clinical trials and research. So it's different things, it's different tiers and different levels that public health can insert themselves with the library, and the library can insert themselves with public health. Okay, Cuyahoga County Public Library in Greater Cleveland, where I live, they serve like 48 municipalities. I remember one year we did something called Know Your Numbers for 27 branches. So this was a community-wide health fair focusing on health metrics. So we brought people in from the public health department. We reached out to retired nurses. We reached out to the hospitals, and we had people come in and do blood pressures. There was a designated day or weekend: blood pressures, glucose measures, cholesterol measures, hearing assessments, and gait assessments. Um, why would we want to know how a person's walking? Anybody know why we wouldn't want to know how a person's walking or how fast a person's walking? Anybody? Yes. Falls. Period. Falls. Can't Gait can't predict risk of falls. Yes, it can. And it was very interesting because those of us who took the test, it was kind of we were laughing about it, because when someone tells you to walk, you don't feel like you're walking normally, you're walking wobbly because because someone asked you to do it. And then they come and they say, hey, you may be at risk. You look a little weak in the legs, and you don't even know this. Okay. So in Ohio, falls are a huge thing. They are a huge thing, and we do all we can through programming like Matter of Balance. I don't know, internally what some public health departments, what the staffing looks like, but Matter of Balance, you guys have probably heard of this: evidence-based programming. Matter of Balance is an evidence-based program, which means if you follow the fidelity of the protocol of the program, you will get the results. In this particular case, the results are building awareness about falls, how to mitigate falls. Okay, they teach you different exercises to strengthen your body. They teach people how to look for things in their homes like loose rugs, nails sticking up off the floor. What do you think one of the biggest things that creates a fall in the home? You can put that in chat if you like. What do you Okay, we have somebody that's real super duper smart here. Loose rugs. Megan Wolf, you were the first one with it. Okay. I've had experience with loose rugs and steps. Sadly, I have fallen. Okay. And I was out in the garden and I slipped on something, uneven dirt, and it was a Jerry Lewis scene. Okay. I laugh about it and I bounce and I get up. However, it really is not funny because you can hurt yourself. Yeah. Okay. Yes. Pets. Why are pets an issue? The smaller the pet is, the more of the issue the pet is, because it is likely that it will jump in front of you. You may not see the little pet and you trip over it coming down the steps. This happens. And we do love our pets. Yes, poor lighting. Um, and this goes back to, things like as we get older, our vision may become somewhat dimmer. Okay, and we don't have enough light in the house so we can see things. This is why I know our organization, we do something called adult vision screenings, and we're the top adult vision screener in the state of Ohio. And this is another thing that public health entities can do. You can have your staff trained or one or two persons to do adult vision screenings and partner with the local library to do those screenings on site. Okay. Especially in areas of economic distress, because you can, if you're eligible, financially eligible, you can receive free glasses. Oh, yes, let's not talk about the flip-flops. Someone put flip-flops in the chat, and I'm going to say improper shoes. I was at the store. I wear a size 8 shoe. They didn't have my size. They had a size 9, and the shoe person said, I'm not going to suggest you buy that because it's not going to fit your foot properly and you could fall. But of course, the shoes were cute. I purchased them, and guess what happened? I fell. So, yes, improper shoes, not using a cane or walker. Yes, we can be a little, I don't want people to see me with the cane or walker and slip and fall. Drug use. And this is prescribed drugs. Um, some of them can make you fatigued, some can make you feel dizzy. Okay. And you can fall from that. That's why it's important for people to have their medications checked to see if there are contraindications. Yes, neurological diseases like Parkinson's. So there are a lot of things that are going on with the fall situation. Next, please. Okay, we have some more scenarios here. And feel free to share my slides with everyone, and anyone that is on the call or anyone that you know of that needs more assistance with, programming for older adults or how to connect. I'm pretty good at coming up with those things. You can always feel free to reach out to me. Karen and Megan will give you my information. So we have folks partnering with public health and libraries to do virtual supermarkets. A partnership between the Baltimore City Health Department and a local grocery store and the library allows patrons to order groceries online and pick them up at the library. How about that? Now, I'm going to say this as we're going through these scenarios, okay? Clearly, someone is funding these programs and these initiatives. So when you're developing these programs and initiatives, you always want to keep in mind how will you evaluate the success, the program outcomes, and things of that nature. Uh, and this is a big thing in a lot of communities, Narcan distribution and training. Partnership between the Chicago Department of Health and the Chicago Public Library that makes Narcan available at all the branches. Okay. Um, and sadly, I was exposed to a situation like this. I was actually at a library conference in Seattle, and I was at a restaurant, and I went to the public restroom, and I saw someone lying on the floor. And so I went, got the manager, and they called the ambulance. The person had OD'd, and there was nothing that they could do at the restaurant because they didn't have the Narcan, nor did they have the training. So these are things where, they say, get in where you fit in. These are things that public health knows about. Okay. And so sometimes instead of waiting for an invitation, my call for action is insert yourself and reach out to your public libraries and see how you can collaborate. So, Palo Alto Library. This library addresses high suicide rates in teens by offering extra programming during finals week at the local high school. Who has not been stressed out in high school and college about finals or a dissertation, Dr. Phillips? Okay, Meridian Library District, a library district that checks out bicycles and conducts a regular exercise class for older adults. And all of the programs that I've mentioned, it's, it's how you want your take on it. Your take on it. You can always target and focus on a particular age group. Okay. You can build in factors where it would be more of an older adult program without coming out and saying, this program is for seniors. This program is for people over 55. There are different things that you can do with your marketing. Pima County, I think we mentioned this earlier, where the public health nurse is stationed there. Next, please. Even more. Okay. So these are some things. The network of the National Library of Medicine launched a telehealth interest group in 2021. The group created an online training course for librarians. Telehealth 101, what libraries need to know. Again, this is something that you can do locally. Okay, you can do locally where you go into the library and say, hey, we were thinking, do you have librarians that want to be trained on particular issues? Hey, I got a lot of free programming when I was in the biz because I approached entities that had speakers bureaus. I don't know if your public health department has a speakers bureau, but speakers bureau will draw people to you because people are always looking for folks that can do free presentations or can even tailor presentations to their groups. Charleston County Public Library, they launched a free and fresh fridges where consumers have access to potatoes, tomatoes, cucumbers, and other fresh produce. This action helped reduce local food insecurity. So they actually had these refrigerators at the library in a public area. And if people needed food, stuff was packed into different sizes. And if they needed food, they would just go in the refrigerator and get it. Okay. We talked about the Narcan, and we talked about how Pima County engaged a public health nurse to assist with physical assessments, vaccines, and first aid. Next, please. Okay. Did you know in the library profession, we actually have a certification program and a designation called Consumer Health Librarian? Okay. This is a type of librarian who specializes in providing health information directly to the public, helping individuals find reliable and understandable information about their health conditions, treatments, and wellness practices, essentially focusing on empowering people to make informed decisions about healthcare. So, if you're trying to work with your library, you can ask them, do you have a consumer health librarian on staff? And the reason I say this is because librarians have, many of them have their specialties. Some are youth, okay, some are collections only. My specialty is adult programming, particularly older adults. Okay, and I am working on my consumer health certification, but you can always ask if someone is on staff that's doing that and if you can connect with them. Next, please. Okay, considerations to connect. I just wanted to show you when the best way, and I'm going to talk a little bit about this more later. I only have probably about 10 minutes, but when you go to the library and approach them, put it in terms of something that is existing, something that's valid and reliable, like social determinants of health or the wellness wheel. They would be more prone to listening and wanting to be a part of it if they know it is something that is valid and reliable. And if your public health department has done some existing programming, you can share. Now, at some point, I do want people to put in the chat if they have worked with their public library. But right now, we're going to go to the next slide. Okay, next. Okay, so here are some library industry resources. The American Library Association. I think there's still about maybe 15 to 20,000 of us that are members to this association. Then we have the Public Library Association, and each one of those entities have separate health type committees or roundtables. We talked about the consumer health librarians that are out there floating around. We have the Medical Library Association. We talked a little bit about the Network of National Library of Medicine and how they created the training for the telehealth. Here is a wonderful toolkit bringing public health and public libraries together, a collaboration toolkit. And you can humor me and Google that, and you'll get a free PDF. Podcasts and webinars. The role of libraries in advancing health equity. That was a podcast that was part of a series. And the power of public health and public library collaborations. That was a webinar, and it's still floating around out there online. Next, please. Essential elements to consider. I'm going to try to do all of this in a nutshell to save some time. When you approach libraries about initiatives, programs, and services, does the initiative align with the library's program plan? And you can always find that in the library's annual report. Go to the library armed with this information. Thank you, Megan. Go to the library armed with this information. Libraries love programs that can be replicated because many libraries have branches, right? Is what you're offering something that can be sustained? What resources are required? Can efforts be evaluated? Next. Who are you trying to reach? This information is from Pew. Millennials are more likely than older generations to say libraries help them find trustworthy information, learn new things, and make informed decisions. Okay. And then there's some other things here. I can't see, they're so small, like find information that is trustworthy, learn new things, get information, and it's showing the various generational groups. So I thought that was important because if you're going to think of an initiative or collaboration, you may need to know which group you're trying to target, and this probably would help you with the success of that. Oh my goodness, see Karen, the dog in the leash got tangled on her leg. See, that's a nightmare. That's that's a nightmare. Um, yeah. See, the dogs, they love to lie down by your feet and everything, and you have to constantly be careful about that, as do cats. But we know cats are very finicky and they want you lie down at their feet. Just a joke, just a joke. Okay, next, please. Okay, so connecting with libraries. This is just an insider scoop. Reach out to the branch manager first that's in your area, or the CEO if you have a connection. It is likely if you're working with adults, you'll want to reach out to the adult services staff or the outreach team. Sometimes you may have a connection with friends of the library, or reach out to someone on their board or their advisory council. And I will say libraries are very warm and welcoming to new ideas and innovation and things that they can implement that would be helpful to their communities. Next, please. So contemplating appropriate programs, and this is just a list of programming protocols, like identify opportunities based on interest and community need, create engaging programs, lifelong learning, look at the 7 dimensions of wellness, and then always talk about roles and responsibilities when you're working with partners. Next. Okay, this is my call to action for you all. And you can put this in the chat. This will be kind of fun. We've got our last 7 minutes going on here. What is a program or initiative you would like to create with the library? Do you have an existing relationship with your local library or regional library? Can you think of potential funders that may be interested in a collaboration? And most importantly, I grew up with United Way, so I'm always about outlining things in a logic model. It's coming quite handy over my life. So let's have a mad fury of ideas that go into the chat. What is your dream collaboration with your local library? And it could be anything that involves health, social determinants of health, what falls on the wellness wheel. Oh, somebody was ready. Oh, we offer regular health screenings. Okay. Nice education classes. We support any of their local community health fairs. Beautiful. The libraries have representatives who participate in the consortium for a healthier Miami-Dade network. That's fantastic. Listen to this, folks. Okay, these are things that you can replicate in your communities. I am the chair of my BOH, Board of Health Advisory Council. I have monthly speakers to tell tell the advisory council about services. You've inspired me to invite my local library to discuss. Yes, absolutely. The meeting meets right in the municipal complex where the library is. How convenient is that? Okay, how convenient is that? And also, I wanted to mention to you, when you are developing programs and collaborations, in case the library, they're your partner, but in case they don't think about it, remember, you always want to run what you're going to do through someone who's going to receive the program. Even if it's a teenager, have the library, or you guys, you just pull over a few folks and say, hey, we're thinking about doing this. Do you think this would be of interest to teens? They'll give you feedback. We always found it interesting that the library would have a lot of teen programming going on after school, like an after school care type of thing. And the teens would be huddled up outside the library and would not come into the library. But it eventually worked out because strategies were used, like offering pizza. And that got them inside the library pretty quick. Anybody else have a wonderful idea that they think about? Because if you do, some of us might want to replicate it. We'll give you credit, but we might want to replicate it where we're at.
Or any
Okay.
questions? Yeah, does anybody have a question for her, Fatima, as well? Fatima, you are a wealth of information, and this has just been a really, really valuable, very informational session. So much appreciate your being with us and the expertise that you bring. So we just have a couple minutes. So yeah, I just wanted to see if anybody had a question. And there's Fatima's contact information as well that you all can take advantage of. And yes, we will be sharing a link to this recording as well as the slide deck for anyone who registered for the session today, not just attended, but registered. So thank you all so much. Yeah, any questions, any final questions, or Fatima, any final thoughts from you?
No, I just want to say thank you. I want to say thank you, because I do feel that public libraries and public health entities should be connecting. It's about the populations that we serve, and there's so many different things that we can do, small and large. So kudos to all of you, and I wish you wellness and health on your journey.
Thank you so much. I'm going to turn the presentation over to Karan at this point to close us out. Karan.
Thank you so much, Fatima. I've always shared this with her. My grandmother was a librarian, so this is always near and dear to me, as I feel like I grew up in the library, and I still love my public library. So thank you all for attending our final training of 2024, but get ready for 2025. We will start with our annual ageism training on January 16th at 3 p.m. Eastern Standard Time. You can register for this and all of the 2025 trainings on our website under events. And if you are pursuing our AFPHS champion designation, please indicate and note that you have attended this training by navigating to the QR code below, or pausing the training if you're viewing this as a recording to navigate to the website, or again, use the QR code to note that you have attended this training.
All right. Thanks, everyone. We look forward to seeing you in 2025. I hope everyone has a wonderful holiday season and that you have some time to focus on your health and wellness and spend time with family, which of course is always so important. So thank you, everyone. Take care.